storefront. I want to welcome everybody here, and hopefully I can talk loud enough so you can hear in the next room. Somebody said, why didn't we get a bigger room? We do town hall meetings, and like the one last night and tonight, we partner with local civic clubs. This is where the civic club meets. And our newsletters have to be sent out literally almost a month in advance, and they get approval and everything else for everything that's in them. So, you know, believe me, you know, it's going to be warm for y'all, it's going to be warm for me, but this is also where our Houston Police Department works and during the day in this area. In fact, I want to thank the Civic Club for allowing us to piggyback their Civic Club meeting to do a town hall meeting, because we do a lot of town hall meetings, and I've done them for 20 years, and this is the best way we found out that gets people who are active in the community. Because Holiday Forest Civic Club, we have some great neighborhoods around this police storefront. Holiday Forest is one of the civic clubs that partner with us to make sure this storefront stays here, and has APD helping us in our neighborhood with the calls for service and make our neighborhood a lot safer. And so, but Congress is out of session. First, let me see, how many of you were at the meeting last night? Just raise your hand. Sorry, some of it will be a repeat, and because, you know, I need to do it every night to the same, you know, because we have different groups of constituents. That's the other issue. A lot of you got here early, and I'm going to ask you, because last night we had a lot of folks, and a lot of folks who don't live in our district. You know, under our Constitution, you get one member of Congress. You know, now your freedom of speech is great, but if you're younger than me, and there's somebody standing up that's older than me, I would hope you'd give them the chair, because last night we had some elderly folks who stood up for about an hour and 15 minutes, and it would be better if they not do it, particularly if they live in this neighborhood. Because I noticed from some of the sign-in addresses, and I looked at the ones from last night. We had people from literally Mike McCall's district out in northwest Harris County, Conroe. You know, you get one member of Congress, and I'm going to give preference to people who live in our district. Now, it's an honor system, because I'm not going to ask you to show me your picture ID when you ask a question. But I just ask you, you know, that's the way our system works. And this is really for our constituents. Because
what if you serve on a committee that affects outlying districts?
Well, no, our congressional district is about population, and, you know, I hope you're our constituents, but if you're not, welcome to East Harris County. And, you know, but again, we try to make sure that we deal with our constituents, and that's what we do every day. If you call our office,
I wish that y'all would let him speak first.
Yeah. Well,
wait till we get to the question.
the way our town hall meetings work is that they're really informal, and again, normally we have 25 or 30 people because we do so many of them, is I'll stand up and talk about a couple of issues that are probably the most controversial, and then we'll go to questions and comments or answers. And the best way I found out is that, you know, you make your comment or question and give me a chance to respond, and that way we'll work it out. And we're going to be out of here around 7:30. Last night it ran a little bit over because I'm going to try and get every question I can. But there's no way, as you know, if everybody raises their hand, everybody's going to get to ask a question because there's not enough time to do it. I joke, I'm not a U.S. Senator. We don't get the filibuster. So we do have time limits on the House side, those of you who watch C-SPAN. So we do have some time limits on how long we can be here. The Congress is out of session, and I assume members from all over the country are doing town hall meetings, whether you're Republican or Democrat, because this is the first time this year we've actually been home during a work week. I come home every weekend, but typically it's been coming home on Friday night and going back early Monday morning or sometimes late Sunday night because of the number of votes we've had on the floor of the House and our committee work. I serve on the Energy and Commerce Committee and the Foreign Affairs Committee. And most of my work is on health care and energy. And those of you who live in our district know that we have lots of petrochemical complexes in our job base and our tax base. And I'm honored to represent the Port of Houston, which is the biggest foreign tonnage port in the country. So, so energy is important along with health care. And this year, seniority does help you. I'm on both of the subcommittees that dealt with probably the two most important issues that was Congress considered the last 7 months, whether it be cap and trade or carbon control legislation or health care. And so both those bills, or at least the one on health care, came out of the committee late Friday night, and I'll talk about that first and then go to cap and trade. The health care bill, this is not something new. There's been proposals for reforming health care on a national basis for many years. States have been trying to do it for years. Even the state of Texas, in a way, in the 90s created a high-risk pool. And the problem is that, you know, if somebody has a chronic illness and they go to the insurance market, they pay, a lady last night, her and her husband own 2 small businesses, and they paid $1,000 each. They don't provide it for their employees, but for them, they had individual policies. They had to pay $1,000 a month because they both had chronic diseases. On a national basis, that's why nationally, the best numbers I've heard, anywhere from 40 to 50 million. The one I hear mostly is about 47 million people are uninsured. 60% of the folks, though, get their health care through their employer. And President Obama, unlike President Clinton actually drafted the bill in the White House and sent it to Congress. He was smart enough to say, these are the goals that I have to cover health care. He didn't draft the bill. That's Congress's job, because we do that anyway, no matter who's the president. So he said, I want something that covers everyone. I don't want to mess with the 60% of the folks that have coverage through their employer, because that's a success. Now, on the other hand, as a Democrat, I'm having folks who say, why don't you want a single-payer plan like Canada or Great Britain or Western Europe has? And the problem is our country historically made a decision after World War II, when we were rebuilding those countries we defeated or liberated. They created national health care plans. Japan, South Korea, they all have, in Western Europe, all have national health care plans. It's a government-run business, except they also have the private sector, and so those aren't perfect. In fact, that's part of the problem. But after World War II, we started using employer-based insurance. In fact, it started during the war. And we used to have even more of folks covered by their employer. But in the last 20 years, we've seen, and even more than 20 years, huge increases in health care costs. And employers are either cutting back, raising deductibles, doing all sorts of things to be able to continue to afford that. And so that's why we have to do something with those 47 million people who are showing up and getting some type of health care, and that, you know, typically through the emergency room. And believe me, employers know that they're paying higher dollars. They're paying for it. So that's why a solution has a lot of support on trying to deal with it. And that's what President Obama said. Take care of the 60% that have coverage. That's fine. And of those 47 million people, about 8 or 9 million are undocumented and illegal. The bill doesn't cover them. It's the same thing as current law. And you know, I'm glad to show it to you where it does. But Medicaid doesn't cover someone who's undocumented right now, and that's what this does. So we're not going to be able to cover those 8 or 9 million folks, and so that's what. So they're not going to be there. But we have about 25 million people who work, and they work at a company that doesn't provide insurance, and they can't afford to buy it on an individual market because they may work, and a lot of them are our constituents that they can't afford to go out and buy them an individual policy for them, their wife, or their spouse, and their children. So they go uninsured, and that's not unusual. When I was growing up, my dad had a small business in Northside Houston on Irvington, and some years we had health insurance, some years we didn't, depending on how good a year it was. And so that's really the nature of the economy. And when you represent a district like we have, that's a blue-collar district. By the way, our district, for those of you who don't know, actually goes from Greenspoint Mall to the Fred Hartman Bridge in Baytown. We have half of Baytown and back toward downtown, almost to Minute Maid Park, and out Gulf Freeway. So we have the older areas of Houston, lots of senior citizens, and we have north side, literally from inside of 610 Loop out to Greenspoint, east of 45. So that's our district. And industrial area, hard-working folks. I grew up there in north side, and so did my wife. By the way, let me introduce my wife, who in January will put up with me for 40 years. And yeah, she deserves an applause. But also, I don't have the staff in here, but y'all met them when you came in. Yorova Harris and Marlene Clowers, they actually work at our East office, which is just down the street, in that building that's right next to Papacitos. If you're from East Harris County, everybody knows where Papacitos is on I-10. So I tell people we're in the building next to it.